Hello, I'm Dr. Abhishek Katha. I'm a consultant general and advanced laparoscopic surgeon working at Lux Hospitals, Gachibowli, Hyderabad. Acute appendicitis is always treated by surgical methods in the terms of either going for a open or laparoscopic surgery. Now it is always laparoscopic surgery which we advise for any acute appendicitis because it is a very minor surgery compared to other minimally invasive surgeries. So for any patient having acute appendicitis, we always advise surgical method in spite of medical treatments because the medical treatments will not cure the acute appendicitis completely. Hence, if the appendix is not treated completely, the patient will end up with a ruptured appendix. That can be avoided by surgical technique because in patients with medical treatment alone, there is always a chance of recurrent appendicitis, and the recurrent appendicitis is more prone to rupture of the appendicitis. When the patient has a ruptured appendicitis, the patients produce symptoms of severe pain, fever, abdominal distension, and complete infective signs and symptoms. Hence, we recommend undergo laparoscopic appendicectomy in spite of medical treatment when there is a proved acute appendicitis. Acute appendicitis presents in the form of severe pain in the right lower abdomen, which is sharp and continuous. Especially in children, the pain is continuous and it will have a severe effect in the future of the kid. That is why we always advise an early diagnosis in those patients whoever is having a right lower abdomen pain. The normal size of the appendix is usually less than 6 mm. And then 6 to 8 mm is an early appendicitis stage, and when the size of the appendix crosses 1 cm in diameter, that is when we give a confirmed diagnosis of acute appendicitis which will need an immediate intervention. Appendicitis is the infection of the appendix in the body. Appendix is an extra organ which is a part of the large intestine, and appendicitis in children also comes same way as in adults. So in children, probably because the children will not be explained the symptoms properly, they will just keep crying. So that is because of the pain in the right side of the abdomen. So either in adults or in children, the pain in the right lower abdomen is always a sign that it could be an acute appendicitis. The main symptoms of appendicitis is pain in the right lower abdomen, nausea, vomiting, loss of appetite, and also fever sometimes when the infection is severe. In children, the basic presentation will be pain due to which the child keeps crying. So if at all your child is continuously crying and pointing out that there is a pain in the abdomen, then you have to always suspect that there could be a chance of appendicitis. In case of children, the appendicitis comes in a severe form. So usually when we treat patients with appendicitis, if they are in the extremes of age in the form of either children or old men, then we advise for a surgery immediately. Medical treatment usually is not promoted in cases of children because the chances of rupture of appendicitis is more common in children. Hence, we always advise patients with proved appendicitis to undergo surgery as soon as possible. Laparoscopic appendicectomy is done by putting 3 holes in the abdomen. All these holes are either 5 mm or 10 mm holes, which is less than 1 cm. So in advanced laparoscopy, we use only 3 holes, and then these holes usually get healed within a week's time. After an acute appendicitis, the patient who undergoes laparoscopic appendicectomy does not need any bed rest for the next few days also, because it is a very minimally invasive surgery in which it is done by putting small 3 holes, and hence the recovery will happen within 24 to 48 hours. Hence, we do not advise the patients to have a bed rest, and we ask them to continue their regular activity as usual. There are no specific do's and don'ts that we advise the patients after an acute appendicitis surgery, but then we always advise the patients not to do a heavy working exercise or lifting weights because the patient may have a severe pain when it happens in case of those who are having obesity or any other medical problems.